Good morning, Clint Young. I am Mihiraa. Let's start the warm-up sessions. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities, both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I choose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
Which is your favorite destination and why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are very essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I like to give to future nurses.
Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
Your preparation time is over. You can now start the role play.
Good afternoon, Mihiraa. My name is Clint Young, and I am the nurse taking care of you today. Let me explain why I am here and what we need to do. I am here to perform your clinical examination and to proceed with the insertion of a cannula. Do you have any questions, Mihiraa?
Good afternoon, nurse. I'm a bit anxious, to be honest. I'm not sure why exactly I need a cannula to be inserted.
I understand your concern, Mihiraa. You've been admitted with congestive heart failure, which can be quite overwhelming. To help you feel better, we need to start you on diuretics. Using a cannula, we can deliver the medication directly into your bloodstream, which will help it work faster and more effectively. This will help reduce the fluid buildup in your body and improve your breathing. Do you have any specific questions about the procedure?
Yes, I'm worried about the fluid buildup in my body, especially in my lungs. Will the diuretics help with that?
Mihiraa, I understand how concerning it can be to experience swelling, especially when it affects your ability to breathe comfortably. It's important to remember that diuretics are here to help. They work diligently to remove the excess fluid from your body, including the fluid that's causing the swelling in your legs and making it difficult to breathe. As the diuretics start to take effect, you'll likely notice a significant reduction in the swelling, which should make movement and breathing feel much easier. Beyond just reducing swelling, diuretics also play a vital role in your overall health. By easing the strain on your heart and helping it pump more efficiently, they can significantly improve your heart's function and your overall well-being. Taking your diuretics as prescribed is crucial for managing your condition effectively and preventing further complications. We'll be monitoring your progress closely to ensure you're responding well to the treatment. If you ever have any concerns or questions along the way, please know that I'm here to support you and provide guidance.
That sounds good. How often will I need this treatment?
Your question is reasonable, Mihiraa. I will brief you about the treatment. Initially, we'll give you the first dose of diuretics through the cannula. After that, we'll closely monitor how your body responds and reassess your condition. Depending on how well you respond, you might need additional doses. But please don't worry, Mihiraa. We will keep a close eye on you to make sure you're receiving the right amount of medication to help you feel better.
Okay, I got it. Is the cannula insertion painful?
It's completely natural to feel a bit anxious about the procedure, Mihiraa. You might feel a slight pinch when the cannula is inserted, but it's a very short procedure and should be minimally painful. To help make you more comfortable, we can apply a numbing cream to the area beforehand. Once the cannula is in place, we'll secure it with a dressing to keep it stable and prevent any discomfort. If you feel any pain or discomfort at any point, please let me know right away. We're here to make this as easy and comfortable for you as possible.
Surely I will. Nurse, how long will I need the cannula?
That's a good question, Mihiraa. The cannula will stay in place for as long as we need to administer the diuretics. We'll monitor your progress closely, and once we see that the medication has effectively reduced the fluid buildup and you're feeling better, we'll remove it. If it needs to be replaced for any reason, we'll take care of that promptly. Our goal is to ensure you're as comfortable as possible during your treatment. Please let me know if you have any concerns or if you feel any discomfort at any time.
All right, that makes sense.
Great. Now, Mihiraa, could you please give me the consent to do the clinical observation, as well as go ahead and insert the cannula?
Yes, I'm ready. Thank you for explaining everything.
Mihiraa, before we finish, let me summarize our discussion. Today, I'm here to perform your clinical examination and insert a cannula. This is necessary because of your congestive heart failure, which causes fluid buildup, making breathing difficult. Diuretics, given through the cannula, will help remove this excess fluid and improve your breathing and overall health. I reassured you about the effectiveness of diuretics in reducing fluid buildup and explained that they also ease the strain on your heart. You asked about pain during cannula insertion, and I assured you it would be minimal, with measures in place to ensure your comfort. Regarding the duration of the cannula placement, it will stay until the diuretics have reduced the fluid buildup. With your consent, we're ready to proceed. Your well-being is our priority, and we're here to support you every step of the way.